recent years, we have a chance to use CAR T-cell therapy in B-cell malignancies, including non-Hodgkin lymphomas and B-cell ALL. After several years, we have very impressive outcomes with even the patient who relapsed 2 or 3 times with conventional chemotherapies before, less than half of them can be cured with the CAR T-cell therapies. But still, there are some hurdles. The manufacturing process is quite complicated and the cost itself is extremely high. Therefore, there are several the effort to improve this kind of problems, the hurdles. And right now, in today's my presentation, I will try to show you what is the indication of CAR T-cell therapies in current standard cares. And there are several novel immunotoxicities with CAR T-cells. I will introduce them, the audience, the toxicities, and the management of the novel immunotoxicity, including cytokine release syndrome and neurotoxicity, so-called ICANS, and thrombocytopenia, and so on. There will be new directions for allogeneic CAR T cells, including the CAR-NK or the gene editing CAR T cells is around the corners. Maybe with that, we can get the off-the-shelf CAR T cell therapy in the future with much lower cost and much simple manufacturing process. I hope that can be help our patient in the future.